Slips, trips, and falls. 1 in 3 adults aged 65 years of age and older fall each year. By 2025, 35% of Singaporeans will be above the age of 65. In this age group, falling is the leading cause of injuries. Many falls result in hip fractures, and 50% of victims fail to regain their original level of function. In fact, falls do not discriminate by age. Injury-related falls is one of the main causes of visits to the emergency room and long-term hospitalization. Falls can happen to anyone, including you. It is a myth that falling is part and parcel of aging. Falling is not a normal part of aging. While your health and overall well-being may decline, there are a number of active steps you can take to prevent falls. Some people think that if I stay home, I won't fall. However, half of all falls actually happen at home. In this video, I will show you practical tips for reducing your risk of falling at home. Like they say, an ounce of prevention is worth a pound of cure. Home. 1. Reduce clutter in the passageway and provide adequate spaces for a clear walking path. Little things that we don't notice are the ones that can hurt us the most. 2. Open drawers and boxes along the passageway are potential hazards. If you use a walking stick or walker, make sure there is enough space to walk around. 3. Highly polished floor is a slip hazard. Wear non-slip shoes in the apartment. Avoid slippers. 4. Eliminate throw rugs and floor mats, as they may curl up and cause you to trip. Otherwise, pin them down safely. 5. Tripping hazards such as electrical cords should be removed. 6. Staircase should have sturdy handrails. Make sure the surfaces of the steps are made of an anti-slip material. Ensure carpets and runners are securely attached. 7. If your vision is an issue, paste brightly colored anti-slip tapes on the edges of steps to help see the steps clearly. 8. Have lights both at the top and bottom of the stairs. 9. At night, use automatic night lights to illuminate hallways and bathrooms. 10. In the bedroom, a nightlight should always be turned on. Otherwise, a bedside light should always be within reach. Keep a flashlight nearby for emergency use. 11. Check that bed are easy to get into and out of. Use a firm mattress and ensure that the bed is of an appropriate height. You should be able to place your feet flat on the floor when you sit at the edge of the bed. Your knees should be at a comfortable 90-degree angle. 12. Keep a telephone beside your bed. 13. Some medication could make you drowsy or dizzy and could increase your risk of falling. Medication can affect people differently. Talk to your doctor about it. Bathroom. Bathroom is one of the most common places where people fall. 1. If you are using a tub, make sure there are non-slip surfaces both inside and outside of the tub. Inside the tub, always put a rubbery mat in the tub. Wash it often, as soap can build up over time and make it slippery. Outside the tub, use a non-slip bathroom mat. This will prevent you from slipping on wet floors. 2. It is always useful to install grab bars in the bathroom. Grab bars come in different lengths and styles. Get one with non-slip grip so that it will not get slippery when it gets wet. For a comfortable grip, the ideal thickness is 2 to 3.5 centimeters. Hire a professional installer to secure it. Do not use a suction grab bar, as they can detach easily. Do not use towel bars, as they are unable to support your body weight. 3. Install a grab bar outside your bath. A 45-centimeter bar is recommended to help with stepping into the bath. Install them at appropriate heights for you to grab onto them, not too high and not too low. 4. Getting out of the bath can be difficult, especially when the tub is wet and slippery. That's where many people fall. Installing a bar on the wall is helpful. The best place to install the bar is at 45-degree angle. 5. If you cannot install a grab bar into the tiles of the wall, get a U-shaped grab bar that can be installed anywhere without drilling the wall. 6. If you are using a shower room, provide a non-slip shower floor. Use a rubber suction floor mat or adhesive strips. It must cover all of the standing surface. 7. If you use a shower chair, secure it using legs and rubber stoppers. 8. It is always useful to install shower grab bar. Secure it at an angle on the wall that will allow you to grab the lower portion when you are sitting and the upper portion when you are standing. Grab bar beside toilet should be installed at 45-degree angle, at your elbow height. 9. For elderly, it is easy to fall when getting up and down the toilet. Raised toilet seat with handle is a great support. They are easy to install. Just put it on top and screw it tight. 10. Always have a cell phone with you to access emergency services in case you fall. Kitchen. Now we look at safety in the place where we spend a lot of time, the kitchen. 1. Organize your kitchen so that frequently used items are easy to find and access without the need to climb, bend, or reach. 2. Since upper cupboards are most easily accessible than lower cupboards, store heavy items on lower shelves and lighter items on upper shelves. 3. Those items that you only use a few times each year can be stored in less accessible cupboards. 4. Food that you eat all the time, such as cereals, oats, should be stored at the countertop. 5. When using items on higher shelves, try using a long-handled reacher or a sturdy footstool. Do not stand on chairs as they can tip over easily. 6. When reaching for lower cupboards, hold on to the countertop for extra stability and support. Bend your knees and not your back to pick up the items. 7. Avoid using wax on other polished products that can make the floor slippery. 8. Have a mop handy to clean up any spills immediately. Nothing is more dangerous than a wet floor. Use long-handled mop to avoid bending down while cleaning. 9. As we grow older, we need our surroundings to be brighter, see easily. Consider increasing the voltage of your kitchen lighting. 10. Consider the layout of your kitchen. How easy is it to get to carry food and drinks out of the kitchen? Taking your time to organize your home to identify a hazard is a good way to reduce a fall.